The MCGI addresses the problems of healthcare in America in two ways. We are addressing needs in the rural communities. More than 80% of clinical care is delivered in communities, but investigations of new drugs and new technologies are done at large academic centers in urban areas. So there's a disconnect there, and we're addressing that disconnect. Right now in the state of Maine, if you're a cancer patient, your doctor may bring up the Maine Cancer Genomics Initiative and may talk to you about it. We have now reached a point within the MCGI where clinicians from all the practices in Maine have submitted at least one patient, which is quite a milestone. We've enrolled more than 500 patients on the study protocol. Being a non-clinical institution means that we don't compete for patients and for revenue that comes from patient care. So we're seen as a valuable partner. They trust us that we're really in this project to really answer some critical questions. So the overall goal of the initiative, of course, is to kind of raise the bar in oncology care in Maine, to really enable patients to go on neurotherapies, to go on clinical trials. But a really important component of our project is as well to educate the clinicians and to make sure that they're more comfortable with the technology and using the information in patient care.
When I started doing this around 2 or 3 years ago, we didn't know as much as what we know now. Let's say if there is some information that's inconclusive, the JAX lab holds a tumor board, which has different people, highly achieved, who have been dealing with this for a lot longer, seeing a lot more patients, give us their input as to what they feel, and we take that information back to the patient to try and address those apprehensions.
The MCGI itself is the first time that a project has been run in Maine across boundaries of healthcare systems. To run a program like this over a 3 to 5 year period, that hasn't happened like this, and we've been able to overcome barriers.
It's already helped improve outcomes for a few of my patients, and that is the most inspirational part of it. Now this should be an option that should be available to everyone, and I think Jackson Lab has a great role to play.
We were thinking about projects where you can take the education approach, especially in cancer risk genetics, and see if you can help the clinical community identify more patients. We're also really trying to understand what works and understanding what doesn't work, so that we can become more efficient and not just develop technologies because they're really, really great, but also that we can really focus on those technologies that actually make a difference at the end of the day.